Hey listeners, welcome to another season of Cozy One Podcast. We have made it to season 8. This season, I want to shine the light on mama's health, aka women's health, and some of these illnesses that I will be discussing with special guests can also affect men, but I really want to focus on what illnesses women go through and deal with and have to make sure their bodies are in check, have to make sure their diet is in check, especially if they want to carry children or carrying children. And the knowledge of knowing your family history, how important it is for your health and your life. And that's what I wanted to focus on in this season. I hope you guys enjoy all of the guests. We're going worldwide with these guests. I'm talking to women across the water, across the pond, as they call it. I'm talking to women from different walks of life, and I just want you guys to get the information, learn from the information, and take that with you and spread it to someone who, needed more insight on what they're going through or what their symptoms are. I hope you guys enjoy Cozy One Podcast. Don't forget to hashtag Cozy One Podcast. You can find me on Twitter, IG, and Facebook. Hey guys, welcome to another episode of Cozy One Podcast. My name is Shan, mama of 2 girls, okay? That's it, no more, okay? This is season 8, focusing on mama's health. This episode is episode 2, and I want to focus on cervical and ovarian cancer. If you don't get anything out of this episode, please understand that women, you need to see your doctor for your pap smear at least twice a year. If ovarian cancer or cervical cancer runs in your family history, you need to be checked more often. Go see your doctor. I know it's COVID-19 and we really don't want to be in a doctor's office, but we still have to make sure our health is in check. We still have to make sure our pain that we're feeling in between of our menstrual cycles is normal and it's not leading to a cervical cancer or ovarian cancer. We have to make sure a lot of things going on in our bodies as women is okay, and that is what this episode is for. I want you to listen to this episode, get all the knowledge you need to get out of this episode, take it with you, and share it with another woman, okay? Especially if you have daughters. It's very important. All right, let's get into this episode. It's a lot of information. You can write things down, you can replay it, and you can save the episode. I appreciate it.
Hey, it's Anya Dula, and I am the host of Intercultured with Anya Dula. Intercultured with Anya Dula is a podcast that focuses on motherhood, culture, birth work, and travel. And it's just a place for women to come together to discuss our philosophies on motherhood, to discuss our work and birth work, if that's what we do, but mainly to bring women of all different cultures together so that we can talk about how we mother, how we #do motherhood, so that we can learn from one another and learn to love each other. That's really what it's all about. I hope you'll join us. Intercultured with Anya Dula podcast is available on all the major podcast stations. I hope you'll join us. Can't wait to connect.
All right, ladies and gentlemen, and I don't exclude gentlemen because I know there are dads out there that listen to Cozy One Podcast, and you may have a teenage daughter, or you may have a daughter in her 20s, or she's not there yet and you just want to know what you need to make sure you are knowledgeable about. I'm talking about cervical and ovarian cancer. What I want to focus on first is cervical cancer. These 2 cancers are very important, so please go do your pap smears and get checked. The cervical cancer affects women in their late teens to 44 years old of age, okay? It doesn't exclude anybody. For teenagers to get cervical cancer is rare, but it happens. It's at least 20%. You can get cervical cancer by having a long-lasting infection that has went untreated. Cervical cancer can be detected during your pap smear. Malignant, which means very infectious, tumors of the cervix, where the closest part of the opening of your vagina, that's where you would find the cervical cancer, being that it's around the cervix. HPV vaccine screenings can detect cervical cancer. Certain HPVs can be the cause of you getting cervical cancer. Cervical cancer does require a medical diagnosis. You can have no symptoms, but if you do have symptoms, the symptoms could be irregular bleeding or pain, bleeding between periods, bleeding after sex, unusual vaginal discharge, probably a pink color or a very foul smell, or just a lot of pain, okay? The treatment for the cervical cancer can be chemo, surgery, hysterectomy, which means that woman or that teen will not be able to have kids. I definitely went to elementary school where there was a girl in 6th grade that had to have surgery because she was having painful periods, okay? And at that time, I didn't know too much about menstrual cycles because I wasn't getting mine yet. I didn't get my cycle until I was in middle school. Lymph node dissection can be, treatment for it. Weight loss can be also a symptom of cervical cancer, and nausea. So if you notice, hey, my daughter or my wife or my sister is in a lot of pain during her period or in between her period, and she said it's not her period, maybe your sister, your cousin, your aunt, your wife, or your daughter needs to go to the doctors and get checked. You need to get that testing done. Now, let's get into ovarian cancer. They're similar, but either way, women need to go get checked. Ovarian cancer starts in the women's organs that produce eggs, the ovaries, hence why women may have difficulty having kids that have ovarian cancer. Now, Johnson & Johnson's baby powder has been linked to this cancer back in the day. Growing up, a lot of the women in my life use baby powder. They live by that baby powder. They put it under their boobs. They put it under their pits. They put it in between their thighs. Some of them put it in their drawers, okay? It has been linked to ovarian cancer. That's why they got sued. Why is it still on the shelf? I have no idea. But women, please do not put baby powder in your baby's crotch area or your crotch area, okay? Keep that thing under them boobs, under them arms, or between your thighs so that they don't rub together and have any friction, okay? That's cool. Now, ovarian cancer can go undetected until it has spread into the pelvis or your belly, and it can be fatal, which means go get your pap smears because you don't want it to spread to your pelvis. You don't want it to spread to your belly. It is a cancer, okay? The symptoms for ovarian cancer could be loss of appetite or you feeling, Aria! Gotta check her. You're too loud. The symptoms for ovarian cancer could be loss of appetite or you feeling full really fast, pain in the side, stomach, or back, and weight loss. Aria! Close the door now. See, I only got one of them here today. And I need to pick her up from her little weekend sleepover. But that one right there, noisemaker. Okay. Abdominal bloating or swelling can be a symptom. Surgery that can treat it would be a hysterectomy, again, taking away a woman's way of having a child unless she wants to adopt. Radiation, chemo, where possible hair loss can happen. The testing that can be done to detect ovarian cancer can be a pelvic exam, a transvaginal ultrasound called a TVUS, a CA125 blood test, sound waves that look at the uterus, fallopian tubes by putting a wand in the vagina through the ultrasound. Okay? Very, very invasive. But if it's going to save a life, go ahead and do it. 3 in 4 women with ovarian cancer live at least 1 year after their diagnosis. 50% of women are alive at least 5 years after the diagnosis. Women 65 years or younger have a better chance of survival than when you're older, because when you're younger, your body recoups, your body can handle aggressive chemo, your body can handle radiation, and your body can handle invasive surgery. When you're older, sometimes it's too late. When you're older, sometimes it has spread. So if you don't get anything out of this episode with this information, is whether you have cervical cancer, whether you had the HPV vaccine, whether it was detected, whether you have ovarian cancer, either way, it's a cancer. And the earlier it gets detected, the better. If you're feeling pain in between your periods, that's where you can't go to work, pain pills aren't working, you're bleeding, or you're having weird discharge, go to your doctor. Set an appointment and go to your doctor. It is nothing to fool around with. Women die every year from ovarian and cervical cancer, all because they're 1, not getting the right medical treatment, 2, ignoring the symptoms, 3, women aren't talking about it enough amongst each other, and 4, they're just not knowledgeable about the severity of this type of cancer. And I want more women to understand that we are the end say, the beginning say, the must say of our bodies. And we need to understand that we need to know if my chest feels right, if my arms feel right, if my headache is really crazy, or if my vagina doesn't feel right, or my bleeding during my cycle is a bit more severe. And talk to your friends. Has this ever happened to you? Young girls, talk to your friends. Be more open. Talk to your mothers. If you don't live with your mother, talk to your aunt. If you're, don't want to talk to your dad, if you just live with your dad, talk to one of his female friends or someone that's close to the family that's a woman. Don't be afraid to make appointments. Don't be afraid to go see doctors. Don't be afraid to get a second opinion from a doctor. Don't be afraid to demand testing, okay? Because I feel like some doctors don't detect things that other doctors do. I feel like sometimes a second opinion is what you need. Sometimes a doctor has to be changed no matter how nice they are. It is your body. You only get one. If you're very rich, you probably get multiples. But for the most of us, we only get one body. We get one life. And it is our job to protect it, take care of it, and make sure that we are ahead of ovarian cancer and cervical cancer. Thank you guys for listening to another episode of Cozy Moon Podcast. Again, this season I'm focusing on mama's health and everything along with that. Whether you're a girl, whether you're a teenager, whether you're in your 20s, 30s, 40s, 50s, or 60s, it is women's health. And we cannot have new life without women. We certainly can't have new life if women are being left untreated and getting sick and not able to reproduce. Thank you for listening to Cozy Moon Podcast. Peace.